Thank you so much, Neil, for having me today. I really appreciate it. This a great discussion to be part of it. My name is Dr. Ahmed. As Neil said that I was born in Somalia and also grew up in refugee camps in Kenya. Um, I was left. We were forced our homes from Somalia to be a refugee in Kenya. Um, Coming to America, I was a teenager, landed in Cambridge, Mass. I was able to go to high school in Cambridge High and was able to finish and end up going college. Once I graduated college, I ended up going to Massachusetts College of Pharmacy and graduate and get my doctor of pharmacy from Massachusetts College of Pharmacy. I was the first one of my family out of six kids who went to college in here in Boston. After I graduated pharmacy school, I was lucky to have recruited as a job in Maine, which I was very surprised. I mean, which was very different world from Boston. I was landed in Portland, Maine. I worked 16 years as a pharmacist, as a doctor pharmacist, practicing in a pharmacy in Maine. And then I had my parents and my family members living in Boston, Roxbury, Mass. So I always go back home and back and forth. I have actually was involved with helping out the refugee families that had the same experience like I did. I was very lucky to have myself as a refugee. I had a lot of support in the system when I came to Boston. Got a lot of help to be where I am today. But there were many families that and youth and actually young people who never had the opportunity and who never had a chance to go college or even finish high school. Some of them end up going to actually a prison. And after 17 years of practicing as a pharmacist in Maine, I realized that actually this is pretty much, you know, not what I want to do anymore. I want to help and also help out the rest of our community to address the mental health issues that was affecting and actually affecting many families and separating the many families and which uh, African immigrant community or refugees usually do not talk about mental health due to stigma issue. So I was able with our co-founder of Dr. Muhammad Abdullah, we were able to fund a community care clinic which located in 55 Warren Street, Roxbury, Mass. That clinic initially was the reason that clinic was started. We created that we funded that clinic was that there were not enough um, cultural and linguistic appropriate mental health behavior clinics in Mississippi. There were not enough clinicians or clinics that were offering, and that will try to spend time to address the stigma and trauma involved with mental health for many refugees. So that's what makes me really broke my heart that actually I need to give it back to the community who those who did not make it. So I will be discussing briefly systemic barriers among African immigrants in the U.S. Next slide. Next slide. Some of those systemic barriers are language barriers. Language barriers. So you all know that actually in America right now, in terms of mental health for African immigrants, refugees, language barriers is huge stigma for getting access to the mental health system because it's very important that actually a lot of you know having to go to it's very difficult for many immigrants and refugees to get access to mental health because they do not have the language and culturally appropriate services for mental health to to get the service that they need. So most of them do not go to get some help for mental health services. For example, there are some studies that I reference here. There were 15 different studies that look at it, the language, the limited language proficiency, which was a very significant associated with the less frequent mental health care visit for many immigrants families. Because of that, it's very important because of that lack of language, proficiency English proficiency, they were not able to, they don't feel convinced enough to go to mental health services. Limited language proficiency is likely to lead to delays in treatment, inadequate care, and misdiagnosis. Next slide, please. The next issue that also I want to address is also is a cultural barrier, cultural bias and mental health for many African immigrants and also other immigrants is a very huge one because as you all know that actually culture plays a major determinant in terms of for African immigrants in order to get healthcare or mental health services. It's very important to them because they are cultural by beliefs they believe in terms of getting services for mental health. For example, in terms of mental health services and mental health issues, for many African immigrants, the first place that they will go to is their churches or mosques. They'll ask their imams or church leaders to talk to discuss with those issues related to mental health issues. And as we all know that those our imams or the church leaders are not clinicians or not mental health practitioners. So that will delay for services. That will delay for treatment. So they don't get the help they need right away. So that actually creates a lot more family separation, more depression, more anxiety, and there's a lot of also trauma involved with many families that experience as a refugee that came in this country, and they have all those packages. So, for example, if I look at some of the actually examples that I have, some studies that actually I reference here, the provider narratives of interactions of people of color, especially African immigrants, mental health clinics illustrate that mental health fields, organizational culture, and hidden norms are major determinant of quality of care and potential sources of institutional bias. So in a way, for example, in the system that actually in America, you know, money providers are not culturally appropriate, for the treatment that they are providing to their immigrant clients. It's not enough. Another study also noticed provided lack of awareness of their fields hidden norms, which are often rooted in a Euro-American cultural ideals limits that ability to offer alternative practices that may better serve the patients, even when those providers believe that they are applying a patient-centered approach. For example, another study also look at it in the fast, diverse context of the United States. It is a very critical that mental health professionals unearth their own implicit bias while they also taking action into to diversify the mental health fields, broader assumption, structure, and practices. So it's a very important to look at out of box. So when you are treating someone who is from background from immigrants or refugees, some of these patients or clients are experienced they have history of trauma. So it's a very sometimes of some of the providers of background, immediately they don't notice that they don't look the whole scope of the person holistically treating this person of because of the mental health issues. Next slide, please. So another actually big barrier of getting access to many behavioral health for many African immigrants are lack of insurance. As we all know that actually many African immigrants or immigrants overall, when they come to this country, they have to come legalized. Some of them come as refugees, some of them come as asylees. So it takes them a while to get the legal status. So that delays of getting for help for mental health services because of they don't have insurance to seek help. So that pretty much increases chances of suicidal, increases chances of inpatient services, also increases chances for them to go in ERs, emergency rooms. So that takes a really major factor for many immigrants. For example, the U.S. Census data show that immigrants are more likely to be uninsured than the native-born citizens. For example, if we look at this table that reference-wise, overall, the non-citizen immigrants are more likely than 3 times as likely to be uninsured. 44%. Look at that. That's a huge number for Africa, for immigrants overall that who are uninsured. And those who are uninsured have no chance of getting mental health services because of there's a long wait list or because of they don't have insurances to get services. Most of those, the best places to get some healthcare services are the ER, emergency rooms, and they go in and out. For example, if you look at this data, this table, you can see that actually the numbers, how many uninsured for US born and how many, uninsured for non-immigrants, non-citizen immigrants. See the difference. Also look at the income itself. Low income families are even 10 times worse if you look at it. US born, US born citizen, 22% of low income are uninsured. Naturalized citizen, 26%. Non-citizen immigrants, 56% are uninsured. So which means that most likely they don't have access to get behavioral health services. Next slide, please. So stigma, another major issue, which is a barrier for getting access to behavioral health. So many cultures in Africa, or immigrants or different world, they have a major stigma of getting service for getting help for mental health. Because of some cultures don't believe in mental health. They believe it's taboo. It's not for it's not health issue. For example, if some studies that actually I'll look at it is for this. There's research that found out that the Black community has higher degree of stigma associated with mental health illness. In 1990, a public opinion poll found that 63% of African Americans, including African immigrants, believe depression was a personal weakness, and only 31% believe that it was health problem. That's the big differences. Other studies also find that many Black community is more likely to be inclined to say that mental health is associated with the shame and embarrassment. Individuals and families that the Black community is also more likely to hide the illness, and that happens also among the African immigrants and refugees too. They do not talk about mental health issues among outside or even the primary doctors because of the stigma itself that this will be known to other community members that they came from, and it's shame to know that you have mental health issues, and that delays of diagnosis, that delays of getting help, and that will eventually cause family gets separated, or also they will pass that to their young kids and families. And also another individuals in the Black community are more likely to believe that since they are survivors, since they survivors so many adversity, they are strong, and no one that has right to tell them that there is something wrong with them. So they view a mental health issue as weakness, and that is huge even to our African immigrants community. That you got to be a very strong person. If you say that you got counseling or you see a clinician or you got some service, they believe that you're a very weak person. So this is pretty much studies shows you that clearly that there's a major systemic racism in our system that actually is not available to services for many African immigrants and immigrants overall to get services that are culturally and linguistically that are available to many immigrants. Next slide, please. So lastly, I will conclude this short presentation that there are many reasons that affect us that for There's a culture that are barrier for many African immigrants and immigrants to get mental health services. Number one, culture barriers is one. Number two, environmental and systemic issues, a major one. For example, having lack of insurance, also not having actually citizen and not having actually legal labors, cost of services, language barriers, and accessibility are more are most common structural barriers. Also, also a study also there's also a study of diverse and racial ethnic groups that show that immigrants were 15% likely to 15 15% less likely than U.S. born to get mental health services. I mean, to get actually to have individuals to have source of health care, health care, and also to be uninsured. 15% less than um, U.S. citizens. Finally, not for least, but factors that associated with mental health, need for services, perceived, diagnosed, and need that strongest relationship to mental health services. Those with a psychiatric diagnosis for self-graded mental health and for example, those who have exposure to trauma experience are more likely than others to use the services. For example, immigrants related factors such as actual also English proficiency is also, very important. One of the barriers to get mental health services. Social support is the key. Family support, other social contacts were very important and that influences for many that influences on help seeking problems, recognition, treatment, treatment initiation, and studies found that friends and family served as important referral sources into mental health treatment, and loss of that familiar support will actually increase definitely will increase the societal attempts. So I want to include representation that there are many systemic racism that affects many African immigrants to get a mental health services. And thank you very much.